and I'm part of the group that organized this, Butternut Valley Neighbors. And we are just that. We are a group of your neighbors who is concerned about the future of our community. We want to build strong communities and healthy communities. And we believe that part of building a strong community is having an informed community. So on that note, we have invited all of our speakers here tonight, and we've invited, they are all local experts here to give factual information. In an era of misinformation and confusion, I think it's really important to get your information from the source, and that's what we're trying to do here tonight. We would like to thank the Morris Fire Department for hosting us tonight. We would like to thank Boynton Studios for providing us with our sound equipment, and we'd like to thank the Cooperstown chapter of the League of Women Voters for facilitating a moderator with us, with Stephanie Bauer.
Thank you. Thank you. So, like Anna said, I'm part of the League of Women Voters in Cooperstown area, and sometimes we get a bad rap for being politically involved. But I just want to be really clear that the League of Women Voters does not support candidates or does not oppose candidates. We are all about the democratic process. We want people to participate in their democracy. We want voters. We want people just like this to gather and get information. We want people to write letters, to do phone calls, to vote, to run for office, or to hold office. We want the democracy to really work. And so, tonight, you guys all can know that you are really participating with your democracy tonight because you're here and you're getting informed so that you can decide what kind of action you want to take, or so that you can be knowledgeable when you talk with your neighbors. So I want to thank the neighbors, the Butternut Valley neighbors, for organizing and inviting me to come. We have 5 speakers for you tonight. We have Tanya Shalor. She is the CEO at Opportunities for Otsego. We have Maggie Johnson. She's the executive director of the Community Cupboard. That's a food pantry based in Edmeston. We have Dr. Diane Georgeson. She is the City of Oneonta Health Officer, and she was the medical director of family planning in South Central New York. We have Carolyn, who is the Director of Legislative Affairs and Grants at Basset Healthcare Network. And we have Tamie there on the end, the Director of the Otsego County Office for the Aging. And just like Anna said, figuring out what's true can be difficult sometimes. So we're going to hear from these people what's true for them and their organizations. It's a good source. For a good meeting to happen, we have to have like an intention or a purpose. So that is really our purpose today, is to get accurate information to as many people as possible, and then decide if it's something affecting you and your neighbors. You can decide at the end of the program if there are any actions you want to take. And to support that, inside the program, you'll notice that the Butternut Valley neighbors have supplied you with resources. On the back cover and inside, you'll see the addresses for all these people if you want to follow up with any questions to their offices. And on the back, it's the federal and state representatives, both phone numbers and email contacts. So besides voting, contacting your representatives is a good action to take. So that's our purpose. Remember what our purpose is tonight. Let's see. Purpose, intention. Okay, the other thing I want to let you know is that we have 2 members of the press here. So newspapers are another way that we can get accurate information. We have Emily Popek here from the Daily Star, and Teresa Winchester on the other side there. She writes for the All Otsego, Freeman's Journal, and Hometown Oneonta conglomerate of newspapers and information. So thank you both for being here to get this information out to a broader public. I think the last thing I want to say is that government doesn't happen just in Washington, D.C. We have government in our local towns, we have government in the state. That's why things that happened in Washington recently maybe made people in Wyoming get fired from their jobs. We have government around us and in many levels. So keep that in mind when you decide what actions you're going to take at the end of the night. Okay, so I think I'm going to go ahead, and each of our speakers, they're in the order that they're going to go, has given us a brief bio about themselves. So I'll tell you a little bit about them and then turn the microphone over to them so they can tell us. They've got a series of questions here that they're supposed to answer, and they can start to give us some information. After they're done speaking, we'll have time for questions from the audience. So I think in the back, do you have papers, or is there a way for people to write down their questions, or you can raise your hand and maybe you can get a paper and write some questions, and we're going to try to do as many of those as possible. We'll do that for a little while, and we're going to try to wrap up maybe at 10 of 8 or so, quarter to 8, so that there's time for you, if you want to speak to each other or to speak to any of these people, not in front of the whole group. So that's kind of how the evening will go. So first, we have Tanya Shalor. She has served as the CEO at Opportunities for Otsego, Otsego and Oneonta since July of 2024. She was the CFO for the agency from 2013 to 24 and was its Head Start Director from 2010 to 2013. You might also recognize her because she also served as publisher of the Oneonta area newspaper, the Daily Star. Let's see, she's currently a Board of Education member in Worcester, a board member of the New York State Community Action Association, and sits on many community action committees at the national and state levels. They live locally in Worcester with their daughter Haley. I'm going to turn the microphone over to Tanya, and she can get us started. Thank you, Tanya.
Thank you, Stephanie. Thank you all for attending tonight. It's great to see a great turnout. As she shared, I am recent promotion into the CEO role at Opportunities for Otsego, but I've been in community action for over 15 years. So it's near and dear to my heart. Started in Head Start, worked my way up, dealt with all of the financial grant funding, and now at the helm of the organization because we have great people and the services that we offer to the community are much needed. So I'm going to, questions that we were asked to address are how many folks do we serve in the county? So we serve about 3,500 households annually, and indirectly with referrals about another 1,500. So add that together, it's about 5,000 throughout the county per year. We also have 15,000 hours of logged volunteer service through the community supporting the efforts of all of our programs. The next question is, what services do you provide?
Do you want to stand it up?
Sure.
I think in the back we're having trouble seeing.
I'm just going to go with the flow. Can everybody hear me? All right, wonderful.
There's people outside.
Oh, they say they can hear me. All right. So the services that we provide at Opportunities for Otsego. First, we have WIC, which is Women, Infants, for nutritional services for young families through the age of 5. Building Healthy Families is another program. That's to stomp out child abuse. So starts with young parents from prenatal up to the age of 5 as well. To be eligible, it's a 3-month window. That is a volunteer service. It is not an eligibility service. Make sense? Because many of our programs have federal poverty guideline eligibility requirements. The next and biggest program that we run is Head Start. We have 11 centers throughout the county. We serve over approximately 300 families with early Head Start and Head Start in center-based operations, as well as home-based operations where we're going into the home to provide those services to eliminate the transportation barriers. We also have a small Wheels to Work program to help folks that are eligible make repairs to their vehicles, DMV service fees that they may not be able to afford, insurance, etc. We have the weatherization program that helps energy efficiency within homes. There is a lot of regulatory requirements around that. That is also federal funding. We have our administrative offices right at 3 West Broadway, which is right behind the Oneonta Boys and Girls Club, and across from the 6th Ward, depending on how you're feeling tonight. So we are located there. We also have our emergency housing program. So we operate the county's family homeless shelter, which is located in Oneonta. We also have rental assistance through HUD, which is again federally funded, to get folks that are homeless into safe, affordable housing, help them with rental assistance till they can get on their feet and be self-sufficient. We also deliver the domestic violence services throughout the county. So that's a several-pronged approach. We have advocates that work with the county court system for child advocacy, so they accompany children in that process for those that are experiencing domestic violence in their home. We show up to the hospital if there's a sexual assault, work closely with law enforcement, and we also go into the schools to educate both at the grade school through high school, as well as we have campus hours on SUNY and Harvard's campuses. We'll deal with cyberbullying, what's okay, what's not okay, and have campaigns. We have a hotline 24/7, and we also run the 24-hour, 7-day-a-week safe house. It's non-disclosed, so if someone wants to flee, we can get them safe housing for them and their family, as well as we have arrangements with partners throughout the county. Many won't leave without their pets. We have partners so that they can bring their pets with them. So those are the services that we provide. I'm only on question 3. So question 4, how am I doing on time? Okay. The impact of our services and the jobs that we support and how the bill might impact it. Any federal cuts will diminish our capacity to serve throughout the county. We are about 85% federally and state funded. So it's a big cut and a deep cut. So biggest concern is as these cuts may or may not come to fruition, it will impact our capacity to serve those 5,000 families that we're serving now, because with the cuts, decreases staff, because that's 80% of our budget for staff and fringe. So the funding goes down, the staff get cut, the less people we can serve, because there are capacities for how many people we can serve per person in the regulations. So we also foresee a need that is going to grow with not additional funding behind it. It's food insecurities, rental assistance, utility support. We're feeling that now. Cuts will make that deeper, and a deeper need for our families, our partners, our neighbors, elderly, young families, you name it. And the broader effect that I think anticipating in the community is, on a positive note, the community itself is coming together and helping their neighbors. The executive directors of all the nonprofits are coming together and having discussions, so we're not duplicating services, so we can make those dollars stretch and meet the needs that are being demonstrated. We just did our 3-year community needs assessment that gives us all the data and input throughout Otsego County to demonstrate where are the highest needs. Used to be daycare slots. That's not so much anymore. Now it's food insecurity and aging population and services for that group versus the young group. So I also think that the cuts will show a greater need, limit capacity, and now there is certain eligibility that's automatic with SNAP benefits and Medicaid. Those that may lose those benefits long-term will now come out of automatic eligibility for other services such as Head Start, WIC, etc. So that will, in essence, take their eligibility out of the other supports. So they're getting a double-edged cut. So that's where I feel that would go if those cuts go into place. And that is, I think, the end of my time. So.
Thank you. Sobering but honest. Next we have Maggie Johnson. She's the Executive Director of the Community Cupboard. That's the food pantry based in Edmeston, New York. She's led the program in building feeding support through a mobile food pantry program, which brings food resources closer to the neighbors that are in need, as well as a hub program. I imagine that's like a steady in a building kind of place.
Kind of.
Yeah.
We'll talk about it.
Yeah, supporting food pantries throughout the county with increased access to perishable products like produce and dairy. Maggie.
Thank you. I'm Maggie Johnson. I came in late with my hair on fire because it was delivery day, and that's just how it goes on days like today. Community Cupboard started in Edmeston. It started in the church basement in 2017.
Microphone a little closer.
2017 or so. And we have expanded, and now we serve the entire county of Otsego as well as Chenango. And we provide support services to as many neighbors as we can. So, how many people do we serve? In Otsego County, last month we served just over 3,500 people through our program. We provide food resources. We are not near as diverse as OFO. We focus very close on providing food access. Food access looks different for different communities and different people, different ages, different housing situations. We have neighbors who are unhoused, we have neighbors who own their houses, we have neighbors who may not have electricity today. But what we know is that we live in a place that nobody should go hungry. There's no reason that anybody should not have enough to eat. So we provide our home delivery service, which means if you have an inability to access services, food pantry services, we'll bring it to your house. We provide our mobile program, which serves communities from Cherry Valley all the way to Skinevas to Unadilla and places in between on a weekly, bi-weekly, or monthly basis in conjunction with local services. So food pantries in your community, we would come not at a time that would interfere with the work that they're doing. We also have our hub, which is exactly what it sounds like. It's a refrigerated place that holds extra produce and things for programs, because like your house and your refrigerator, you don't have room to hold as much as you might need, right? Our programs are the exact same. So we have the place that holds those, and then we get to take it and share it. Our organization funding comes through a lot of grants. We do private grant writing, foundation grant writing. We also rely heavily on USDA commodity foods and Nourish New York. That's a line in the state budget that buys food from local New York growers and producers that our programs then can access for free. We rely on those services, and what we've seen is not just through the bill that was passed last week, but beginning back in January, USDA foods and commodities began to be rescinded and pulled back. Now the government has declared or decided that there's a certain amount that has to go out through the USDA. Food banks have access to that, and we can explain all of that at another time if you're interested in learning. But then there are other opportunities that have been in place since COVID. There were lots of extra trucks full of food and things like that now have been pulled back. Regional Food Bank, which serves Otsego County, has lost about 8 million pounds worth of product. Now, that's a lot of food, but they serve a whole lot of area, right? They serve from Canada all the way down to Pennsylvania to New York City, and Otsego County is one of the furthest west counties that they serve. However, all of that food comes with money attached to be able to support the programming. So they've also lost funding, which means that it trickles down, right? So our food pantry programs have lost some of those extra supports as well. This bill, while we don't hold direct federal funding because there's a whole process that goes in place for food pantries, what we know is that the populations that will be affected by reduced SNAP benefits or reduced Medicaid benefits will need that extra help. What we anticipate seeing is an increase in people who need some extra food or need extra support, because now we have to figure out how we're going to fill in our budget, right? Because if I have to pay for all of my medicine, I'm not going to be able to buy all of the food I need, because food is usually the thing that comes off the budget first. It's like the most flexible line on your budget, right? So what we're anticipating is an increase in need and an increase of neighbors that need our help. What we're doing at this moment is working to build networks of people, to build community knowledge and understanding that Community Cupboard can take any extra zucchini you have in your garden. Any food pantry can, in whatever community you're in. So raising awareness to build our network, and maybe you have extra today and you want to buy an extra can of beans, your food pantry will be grateful for that because our budgets are stretched as well. The impacts that we anticipate seeing are our populations that are working or on fixed incomes. So we call them an ALICE population. It's called Asset Limited Income Constrained Employed. It's our, what we call frontline workers, those who are making minimum wage or doing direct care work. So just Medicaid reimbursed work. Those are the populations that are going to be the most impacted through these bills, cuts, budgets, whatever we're going to call them. But the thing I want you to know is there's one more chance that we have to make sure that we get heard, because the Farm Bill is coming up. And please communicate with your local, with whether it's Josh Riley or, I can't remember, Senator Gillibrand or Schumer or who it is that represents you, and tell them that the Farm Bill is essential to our communities, because the Farm Bill also holds the SNAP budget. The Farm Bill also holds the extra supports for our neighbors, for the people that we work with every day.
Next we have Dr. Diane Georgeson. She's a native of Oneonta, a retired OBGYN physician who worked at Fox Hospital, and she served as medical director of family planning of South Central New York for many years. And she's been the City of Oneonta Health Officer since 2020, and she's prepared with those same questions. Thank you.
Thank you. Can everyone hear me? I am not a service provider at present, so I'm not going to tell you what I can do. My colleague from Basset Healthcare will be the service provider on this part of the talk, but what I would like to speak to is what the cuts in Medicaid mean. As many of you know, a big piece of this legislation has to do with cost savings at the expense of cuts to Medicaid, estimated over a 10-year period to be close to $1 trillion. Just a brief review of what Medicaid is. Medicaid was established in 1965, along with Medicare, in order to provide health insurance for low-income Americans. In 2010, with the passage of the Affordable Care Act that was then fully implemented in 2014, states were given the option to expand Medicaid to include nearly all adults under the age of 65 with incomes at or below 138% of the federal poverty level. So that what we saw in New York State, who chose to adopt the expansion, is that less than 5% of people now are without health insurance. And just as we think that food is important for people, I think health insurance is important for people too. A few more numbers. Nationwide, over 70 million people, or approximately 23% of the population, are covered by Medicaid. In New York State, approximately 7 million people are enrolled in Medicaid. This includes coverage for 49% of births, 25% of adults ages 14 to 64, 44% of children, and 64% of nursing home residents. Medicaid, to a large degree, pays for long-term care because Medicare doesn't. In New York State, an additional 1.6 million are enrolled in the Essential Plan, which is part of that affordable care expansion. So these are the people that will be impacted by cuts to Medicaid. Medicaid is funded by a combination of state and federal funding. In New York State, about 64% of our funding comes from the federal government, the rest comes from the state. But the Essential Plan, which is the ACA piece, is funded primarily through the federal government. 95% comes from the federal government. In terms of local numbers, most recent data I could find from May of 2025, in Otsego County, 13,191 people were enrolled in Medicaid, accounting for 22% of our population. An additional 3,299 were enrolled in the Essential Plan. Do we want to hear about other counties? Are we mostly Otsego County here?
Chenango.
Okay, Chenango, 14,333 folks are enrolled in Medicaid. That's 32% of the population, higher than Otsego. Additional 2,879 in the Essential Plan. Delaware, Schoharie counties both come in at 24% of population on Medicaid. So, big piece of our community, a big piece of our communities receive Medicaid for their health care coverage. So what are the impacts of this bill that's going to, over 10 years, cut $1 trillion in Medicaid? The Congressional Business Office has estimated that an additional 11.8 million people out of that 70 million in the United States will become uninsured by 2034 due to provisions in this bill. Also, another 5.1 million will lose coverage because of the changes to the Affordable Care Act. According to the governor's office in New York State, we project that 1.5 million New Yorkers of that 7 million may lose health care coverage over the next 10 years. So, not great news. I don't have the individual estimates for our counties, but for those of us, which I think most of us are in District 19, according to Josh Riley, individuals losing Medicaid and becoming uninsured, 32,864. Again, that's for the whole District 19. The other important thing is that in addition to losing coverage, those covered by the Affordable Care Act will see increased premiums. There are many ways in which this bill will lead to decreased enrollment in Medicaid, decreased coverage. And I won't go into all of them now. Carolyn may speak to some of them. I will just say that a big piece of it has to do with these work requirements. And the work requirements are how this bill is kind of defended and sold to some people. But what actually happened when states tried to institute and did institute these work requirements is that many people who actually were eligible for Medicaid lost coverage because simply they didn't have the administrative support to help these folks document that they were working or met some of the exclusions. So if I were to leave you on a hopeful note, I would say that part of our work as communities and as the state, because the state is who's going to be responsible for implementing these work requirements, which are due to be implemented beginning next year. Part of our work is supporting our Medicaid recipients in making sure there are not administrative obstacles to document that they in fact either are working or trying to work or have an exemption that's valid. So that's where I think we can come together, hopefully as a community and as a state. I did speak with Josh Riley's office earlier today, and he wanted us to communicate to you, his office anyway, that they are available if any individuals have concerns around their coverage. So, and later I can take questions, but I will pass it over to my colleague Carolyn.
You know, I just have to chime in. That's like a lot of numbers, but numbers translates to people. When she says 22% or 23%, that's close to 25%, which is 1 in 4. Which means that if we look around the room, there would be, you know, a dozen or more people here that are going to be impacted by those numbers. So don't get lost in the numbers. Think of the numbers as people being affected. Next we have Carolyn Lewis. Carolyn has spent 2 decades helping to foster community and economic development initiatives and to cultivate strategic partnerships. She currently serves as the Director of Legislative Affairs and Grants at Basset Healthcare Network. She works to identify and address state and federal legislative issues that impact rural healthcare operations. She advocates for policy changes and tries to secure funding through state and federal grants. Let's see, she represents Otsego County on the Mohawk Valley Regional Economic Development Council and is a board member at Pathfinder Village. Lots of other things too. These people are multi-talented.
Thanks, Stephanie. Good evening. Thank you for hosting this and including me in this presentation. I am Carolyn Lewis. I'm the Director of Legislative Affairs at Basset, so this is my world. I'm going to go through some more stats, and Stephanie's right. The devil is in the details here, and I do want to also start off by pointing out things that Tanya has said. Tanya specifically kept saying if, and so people, everyone in this room should understand that you have a voice to call your legislators, you have a voice to be talking about this, and just because this bill has passed, there's opportunity to continue to combat some of the cuts that may happen. So I am going to give you a couple of more statistics and try and put this into some perspective. So as Diane said, the Congressional Budget Office has estimated that the federal spending on Medicaid and children's insurance program is up to $1 trillion over the next 10 years. So they anticipate achieving these cuts through work requirements, restrictions on state funding and payments, either directly to hospitals or to other entities, more frequent eligibility requirements, and that's really a key piece to the essential plan participants, and limitations on expansion. And a lot of this has to do with nuances in taxes and how the federal government partners with the states and the county to leverage and deliver the Medicaid dollars. But those are really what's going to drive the cuts, is putting in more work requirements, accelerating eligibility from 90 days to 30 days. So if you can imagine the numbers that we're talking about and the resources available to help people re-enroll and to come up with additional documentation is going to be a challenge, but is not overcomable. I don't think that's a word. So how that flows, and Diane talked about, so Medicaid is a sharing program between the federal government and the state. The federal government provides about 50% of the funding. The rest falls to the state, and Tamie will tell you how also it falls to the county as well. So of that $1 trillion, New York State is estimating that they will lose $13.5 billion in federal health care funding annually. So at this time, New York has not messaged a formal response to the budget shortfalls that they have to address, in part because a lot of these cuts and requirements are going to be phased in over the next several years. So New York State is going to have to come back, and our local or our state representatives are going to have to make some pretty arduous decisions about how the state funding gets implemented. New York State is a very generous state to Medicaid, and they are committed to helping populations across rural and the urban areas. I just want to take a pause here from a Basset perspective. It is my job to monitor legislation, not only on this, but ongoing. We are deeply committed to keeping an eye on what is happening. We are in regular communication with our state and federal representatives. We are advocating for Basset and for our patients. And so we have advocacy agencies and local partners. So we are continuously working on this. Our leadership team is deeply engaged. And Basset over the past 18 months has spent a lot of time doing some strategic work in making sure that we are sustainable in-house. And that's everything from supply chain to productivity. So we are really trying to maintain and secure our financial position so that we can weather any disruptions. Our primary goal is to take care of our patients. That is our priority, and that is who we are. So and with that being said, we will continue to provide care to everyone regardless of coverage. That is our mission. And so I just want to sort of lay that out there, as Basset understands that there are a lot of concerns out there, there are a lot of questions, there are a lot of unknowns. So we are, actively monitoring this. A little bit more statistics in talking about Basset. You're probably all pretty aware of us for the most part, but just to give you some numbers, Basset sees about 244,000 patients annually. We do that across 8 counties that have 5 hospitals, 30 health centers, 22 school-based health centers. So our geographic footprint is essentially the size of Connecticut. So we're in your communities, we are there for you, and we are obviously one of the largest employers, not only in Otsego County, but across the region, and we employ about 4,000 practitioners, caregivers, frontline staff to deliver that care. 26% of our net revenue comes from Medicaid. So it is a substantial piece of our funding. 26% of our emergency department and prime care visits are by Medicaid patients. 76% of our nursing home residents are covered by Medicaid. 60% of our pediatric population is covered by Medicaid. So we do have, and that's not unusual for especially rural entities. About 77% of our total revenue comes between Medicaid and Medicare, Medicare being the largest funder for those services. And again, if you want to talk about statistics, I am more than happy to talk about it another time. So there are, as I had said, there are eligibility restrictions that are going to come into play. There is cost-sharing expenses that are going to come into play for individuals. There may or may not be direct payments to hospitals that are going to get cut, but we are keeping an eye on this. We are managing our finances, and we are really, really committed to making sure that our patients have access to affordable care on time and where you need it. So I'm going to stop there because...
Thank you. And our last presenter before we get to some questions that you all have generated is Tamie Reed. She's been the director of Otsego County Office for the Aging for the past 8 years. These people are all the experts You're getting to hear the experts tonight. In her role, Tamie oversees a variety of state and federal grants that help older adults remain living independently in their home and community, including Meals on Wheels, home care services, health insurance counseling, transportation, and caregiver respite. She serves on the board of the Otsego County Senior Council, Helios Care, and the Community Foundation of Otsego County. Thank you, Tash.
Okay, I'm going to apologize because I'm not very tall, so you're still not going to see me stand up. So you kind of covered a lot of it for me, so I'll stick to kind of the main points. Again, everything we do is really to help older adults remain living independently in their home and community. So the services that we provide, the advocacy that we do, and certainly the referrals and the connections that we make and the partnerships we have in the community is for that exact effort. We serve about 2,500 individuals within Otsego County. That's anywhere from individuals receiving our services directly to helping family members and caregivers just navigate long-term services and supports, right? This is an area that is completely new to just about everybody until it lands in your lap and then, oh boy, what do I do? So having staff that understands all these different programs, all the different acronyms, all the different applications, that's a lot of what we do, is helping people kind of navigate regardless of income. It could be veterans that might be eligible for veteran benefits. It could be individuals for long-term care facilities. It could be people for our services or those that are eligible for Medicaid. So as you stated, a lot of our services, we aren't in the office very much. We are constantly out in the field. We're in your communities every day, whether it's delivering meals to people or whether we're providing personal care assistance to somebody or picking them up for medical transport. We are kind of out throughout our rural area providing those services. We are funded entirely by federal, state, and local tax dollars. We receive a small portion of our funding from participants who contribute to the services that they receive. And I would say I probably have a little bit better news. When this was first organized, the federal budget had been leaked out. And at that point, we were told that there were some programs through the Older Americans Act, which as well was created in 1965 to allow older adults to live with dignity. Those funds were looking at being cut, not only separated in two different federal agencies, but then having programs completely eliminated. Because of great advocacy work, and some of those people are sitting in the room today, we found out on May 31st that our funding was fully restored for Older Americans Act and Office for the Aging. So that was really, really great news for us to hear. Go ahead and clap. Guys know that's a lot of work, and sometimes it feels like it falls on deaf ears. So regardless of what your political party is, regardless of what your priorities are, you know, again, having a voice and making sure that the powers to be and the decision makers, you know what the people in the community really need and want. So it's a good news on one hand. On the other hand, that doesn't mean we don't have concerns for our older adult population. Obviously, we're still monitoring the HEAP program, the heating assistance, which a lot of our families in Otsego County depend on, and certainly Medicaid, SNAP, and the different public assistance programs that are also available. So as everybody here at the table, we are very diligently, you know, working with state and federal entities to keep informed. Sometimes just getting the information is the hardest part, but we continue to stay on top of that, and our goal is always to provide the information so that you guys can make the best decisions in your choices with aging. So I'll leave it at that, and then we can open up to questions.
Anna, do we have questions?
We do have a lot of questions. People ask great questions.
So the areas that we heard about today, we have to decide what's important to you. We heard about feeding people and children. We heard about health care. We heard about care for the elderly. At the end, we heard about heating. You know, food, pretty basic things. Healthcare, pretty basic things. So that's what we're talking about tonight, is basic things that people need for their lives. Okay?
So, let's start with,
Shall I read?
you can read, and I put on the back, what I think would be most likely
Oh,
answer.
okay. So, you know, you guys can chime in if you think you have anything to say about this. We won't limit it to one person.
And just quickly, did anyone else have any other questions they had written down that they wanted to hand in? And hopefully we will also have time to open it up for more questions. But I'll come and grab your questions.
Okay, SNAP. We have a question about SNAP. Please explain how SNAP works, what someone can and cannot purchase. How are SNAP recipients affected now with the One Big Beautiful Bill? And how will they be affected later on in 2027? I think many of the things in the bill that just passed are not going to be implemented till 2027 or 2029. You know, it's out in the future. It's going to be phased in over time. So, SNAP.
So SNAP is utilized to purchase food products of any sort that nourish your family. They can't buy toiletries, you can't purchase things like alcohol or cigarettes or feminine hygiene products or toothbrushes. You can't purchase anything like that with SNAP, but you can purchase any food product, right? Nothing prepared, you can't go and get pizza from the local pizza shop, but you can buy lunch meat, or you can buy a frozen pizza if you choose to.
The other part was,
Yes.
how will it be affected in the future, going forward?
So going forward, SNAP eligibility will likely be shrunk a little bit. So what we know is that there are lots of abilities to write off your housing, to write off your utilities expenses when you apply for SNAP. And base amounts of SNAP in New York State are $23. That's the minimum amount of SNAP that you might get if you qualify for SNAP. There was a motion this year to raise that minimum to $100. That did not make it into the budget this year. We're hopeful that that advocacy continues and that becomes a reality. Some of the SNAP impacts will begin this fall when the new budget is enacted. So that's in October. So the new budget starts in October. Some of those are going to begin now. There's a lot of work at the state level to figure out how that's going to look. And we don't have a lot of answers because people are still sifting through all of the paperwork. They're still sifting through the state level. So be paying attention as much as you can, and hopefully we'll be able to share information as it becomes available.
So I have to add to this question because I don't know what HEAP is. How is HEAP going to be affected? How about what is HEAP?
I don't run HEAP, so I will do the best I can. So HEAP is Heating and Energy Assistance Program, Home and Energy Assistance Program. That is an income-based program that assists individuals under a certain income with the cost of heating their homes. And so at this point, that program is slated to be completely eliminated across the board, and that is 100% federal funding. So today I was informed that we were told by, it's OTDA, O-T-D-A, Office of, do you know this one, Tanya? Temporary Disability Assistance. They're the ones that run HEAP within New York State, and they have received no information at the state level. So we are patiently waiting to get more information on that.
SNAP used to be food stamps. In case you're used to food stamps, SNAP is the new name for it.
Okay, these two kind of go together. We're hearing that Medicaid is going to be reduced. How might New York State make up that difference, or who else would, you know, who else would fill in if Medicaid doesn't provide things anymore?
I can take that in part. So I will, I'll talk about one provision that's going to happen probably the quickest, of which New York State is going to have to, first of all, New York State is going to have to make decisions of whether they are going to continue to fund at the full level or whether they are going to have to make cuts to health care and benefits. But in particular, and I'll just point out one thing, is that the first thing to fall on this bill is an eligibility restriction for essential plans, so that's the expanded population in New York State, that is based on citizenship. So there is a regulation that right now, people who are legally here in the United States, who are in their 5-year waiting period to become a full citizen, is eligible for either tax credits and to be in the essential plan. So that has been rescinded. So that eligibility has been rescinded by the federal government. New York State's constitution mandates that that population needs to be covered. So in terms of projected New York State impact, they are estimating that that is going to be a $7.5 billion loss in federal funding to New York State, of which they are going to have to cover. So they will find, yes, sir.
I was just waiting for you to finish. I was on a call with the Every Life Foundation. They were talking about how the big beautiful bill impacts rare disorders, people who have rare disorders today. And to your point, the beautiful bill limits how a state can raise money for the Medicare match, because Medicaid it's a handshake. States pay in, they get matched by the federal government, and the bill limits how the state can raise money for its half for the match. And one of the things they were talking about was taxing hospitals. And so it's just, this thing is just, it's just meant to constrict Medicaid, and it really reduces the way the states can pay for it and come up with their end of the match. And it's not so much now, everybody's kind of, the state will kind of make up the difference now, but trying to figure out how to live with it is what's coming up.
Yes.
Yes.
Thank you. I have another one here. Will Medicaid recipients be notified of changes to requirements? Like, how will the Medicaid recipients know how they are going to be affected?
I'm not sure, but again, it is up to the state. The state will be administering, and currently does, the Medicaid eligibility and enrollment process. So that's a big piece of it, you know, how are we going to tell our community members about the changes, and how are we going to support them re-enrolling when they need to re-enroll, and documenting what they need to document. Is that kind of what you understand how it works?
Yeah, so currently everybody, how I understand it as well, is that all Medicaid recipients have to recertify or be eligible every year. So you have to recertify and you have to re-enroll. That enrollment is now going to go to twice a year. So you're talking about an administrative burden on working families and our local government and CBOs that are enrolling participants. So
Severely understaffed already.
So that's really they do know, because you have to, it's not a forever program. So everybody is enrolling and certifying annually. That enrollment period is just going to be more often.
It's quite a process.
Cynthia.
I just want to highlight what Diane was talking about, that a lot of the money that we may be getting as a state is going to be used for administrative costs. So, and if we're having to do it twice a year, It's more going to the administrative costs, that's what I heard you say,
Okay.
as opposed to direct service.
I appreciate that people in the audience they know their own things and they know things beyond, perhaps what's being said here. But I really want us to stay focused on our presenters. Thank you. I want to stay focused on our presenters and keep mining them for their knowledge. Maggie, what other food pantries exist in our area besides in Edmeston? Do you have a quick list, or are there other food resources besides food pantries?
So you can find your local food pantry at otsegohunger.com. That is our most updated pantry list run by the Hunger Coalition of Otsego County. And we continuously update that with local hours and changes and things like that. Almost every community in Otsego County has access to a food pantry that will serve them. And again, we go back to what we learned through COVID, and what we learned through COVID is that most of our neighbors need more support than once a month. That's just how that is. So that's what finding your local resources and then utilizing extra resources like the mobile food pantry or SNAP sign-on or drive-through pantries, or all of those things are available to anyone who finds themselves needing an extra hand.
Okay, with cuts from the big bill expected to damage Planned Parenthood and similar organizations, what is the expected impact for access to health care and reproductive health in our area? What other sources exist?
Well, I'll try. Planned Parenthood nationwide serves many individuals, men and women, for essential health care needs, cancer screenings, as well as reproductive health related needs. My understanding is that by limiting any federal funding going to organizations that also provide abortion care, that care may be at risk. The survival of Planned Parenthood clinics may be at risk. That's my understanding. Locally, Family Planning of South Central New York, which has offices throughout the region, is not an abortion provider. So I do not believe, but I'm not 100% sure, that it would not be involved in this restriction. Does that answer your question, whoever's question it was?
So the additional resource might be the Family Planning of South Central New York. That's an additional resource that people have available to them here, right?
Yeah, Family Planning of South Central New York serves many people on an income basis. They do accept Medicaid, but also if people are uninsured or cannot pay, there's a sliding scale. And again, they also partner with the county to be the sexually transmitted disease clinic and with cancer screening. So yes, I think all of those services are likely to continue and maybe be even more important as people may lose their insurance.
So we have a local mayor in our audience tonight, and the mayor would like to know from maybe many of you, how can local governments best collaborate with your organization to benefit the citizens? Is there a way that government can get together with your organizations?
I think in a lot of ways we do. I mean, we're a small community, so if we don't work together, we don't get any of our stuff done. But I think in regards to smaller municipalities and things like that, I think sharing the information with residents, sometimes it's a lot of information. We have very thick resource directories and people's like, give us a resource list. it's not a page, it's hundreds of pages. But you guys have the experts in the community. We live here, we're residents here, and I think municipalities can certainly make sure, whether it's through the garbage truck companies who are picking up trash and can see isolated situations, to the post office delivery people, to the volunteer fire departments that are in all of our communities, and just making the information aware so that people know where to begin, getting them to the right spot so that they can get correct, accurate information instead of, inaccurate information by maybe people that don't have the right resources.
Do we have any FQHC hospitals in our area?
No. We have Basset as part of their network has 5 rural health centers, which is a differently federally designated, but those are up in Herkimer County affiliated with Little Falls Hospitals. But we do not have any federally qualified health centers. As part of the Basset Healthcare Network.
How will any of these changes affect people with developmental disabilities?
I know that Springbrook is heavily federal funded, but they have a lot of private funding too. So that's good news for them. But their reimbursements, I'm sure, are part of the cuts planned, so it will have financial impact on them. But I can't speak directly to the finance or services. I don't know if anyone on the panel can. Maybe Carolyn?
So I don't know how deep this conversation really goes, but from a general perspective, right, we have a Medicaid population that is the traditional Medicaid, pregnant women, people with disabilities, children, and then you have an expanded population which occurred back through the Affordable Care Act. It is being said that Medicaid enrollees will not lose their coverage. What is going to happen, though, is that with the recertification and the eligibility, there may be slips, right? That's the concern, and that's where the gap is. The essential plan expanded population gets a little bit more, it's a little trickier only because there are then work requirements. The work requirements are on the 19 to 64-year-old age bracket. It used to be 54. As part of this bill, they expanded that up to 64. And then redetermination. So I don't want to speak on behalf of Pathfinder or Springbrook or the disabled population at all, but it is widely considered that that population will be able to maintain its benefits.
If I understand that correctly, that means they have to have support filling out the proper paperwork, right?
Correct.
Okay. I think we briefly touched on this. If New York State decides not to reduce benefits through Medicaid, which you said are required by law, some of the things are required that they be provided, does that mean increased in taxes?
On the table.
Yep.
That's on the table. It's on the table. Okay. How effective is contacting federal and state representatives when canned responses are given based on the subject area? What's an alternative?
I advocate almost every day. They know my name. They will pick up the phone, because if they don't, I will call back. I will write. I will email. I encourage my staff to do it. I encourage the clients that we provide services for to do it, and I encourage you all to do it. Get in everybody's ear that will listen. They log. They called about this. They called about that.
Yep.
They called about this. They called that. And those numbers are very, very, very important. They may give you a stock canned response, but you will become, unfortunately, a tick in those numbers, which is only good for us. For you, for the community, for the organizations throughout the counties that we serve. So please reach out to your elected officials. Not once, not twice, 10 times if you got the time, 20 times if you have a lot of time, 50 times if you got nothing better to do and have your cell phone.
I think I want to add to that, that canned responses are also okay. They get tick marked as well. They'll say, oh, we got 17 paragraphs, you know, from this one topic or from this one group or whatever. They keep track. They keep track.
And you don't have to be an expert. You don't have to know it. I mean, you don't have to be an expert on it. You have to call.
You can have an opinion. You're allowed to have an opinion, right? You all have an
Yeah.
opinion.
And
You're
they-
allowed.
And they want to hear from you more than they want to hear from me or Tanya, because that's our job.
Oh, here's an interesting one. What's your single worst nightmare? Do we really?
In a work aspect or?
Public services.
Public service.
Okay, right now, to sum it up, the biggest nightmare for me is the unknown. Because every day something changes, some new regulation comes out, some new guidance comes out, then it gets rescinded, then there's an executive order, then the state's response is this.
And then
It
there's
is
a lawsuit.
Yeah, and then it's paused because of this or that. So the biggest nightmare for our organization and the clients that we serve and my staff is just, in one word, the unknown at this point.
Well, keep going.
I was
Worst
gonna say, I
nightmare.
think that truly is that we don't know what's next. We don't know how to plan or how to prep or what we should be expecting. And that's horrifying for the communities that we serve.
I think my biggest nightmare is more and more people will not have access to health care. I think not having insurance limits people's ability and comfort with showing up, and we'll see more people with advanced diseases. And there are even estimates out there that more people will die. So that's what worries me.
Mine is the same as well as the delay of care. Not only in this situation, but that people delay their care generally. And we know we live in a rural area. We know that getting 2 appointments is difficult, but really urge people to not delay their care because it will get worse and it gets more expensive. Not to put a number on it, but I mean, it doesn't save anybody delaying your care.
For us, it's apathy, and I think unfortunately we've seen a lot of it after COVID. People just sitting back and not doing anything and then complaining when something happens. So for us, take charge of your life, take control of how you live, and be proactive and don't sit back and wait for somebody else to take care of you. So that's, yeah, be strong advocates for yourself.
Do we have any local hospitals participating in 340B drug pricing programs?
Yes.
I don't understand the rest of this about a disproportionate share of
Yes.
hospital program. I don't know what that is.
So yes, Basset takes advantage of 340B, and it is a significant revenue generator for us that allows us to support services of which are not revenue generators. Primary care, behavioral health, school-based health. So 340B is essential to Basset's operation. What it is it's a negotiation, we are able to buy drugs at a discounted rate, and then we basically get, instead of the middleman, we get to keep the difference between the wholesale price and the retail price. And so that allows us to reinvest in our healthcare system. Disproportionate share is a federal program that goes through New York State. We take care of a disproportionately share of Medicaid patients that go through, and it's counted on bed days. I'm going to get in the weeds. You don't want me talking. Yeah.
So that kind of wraps up the written questions, but I know that some people may have a burning question that they just didn't want to write about. So I'm going to open the floor to maybe 3 or 4 questions from you guys, but I I want to caution you, make sure you give me a question, not your opinion about all this stuff. Make sure that you're asking something, okay?
Hi, my understanding is that's the federal, and now we really need to lobby the state people. I'm going to say something that some people might not like to hear. This was put through on the federal level by Republicans. Our state senator and our assemblymen are Republicans. Can we depend on them to actually do anything for us?
I'm a little bit confused, so
In other words, we're going to lobby our local governments. Our local governments are ran by Republicans who pass this kind of stuff. How? I'm getting apathy, basically, the right word for it, because they don't answer my letters either.
So our federal representatives, at least for the Basset Healthcare Network, are
Right.
split. Elise Stefanik in the North Country is a Republican. Josh Riley is a Democrat.
Right.
These are both of our
Right.
senators.
Okay, so that doesn't address New York State taxes.
New York State, he's looking at the state level. State level.
State,
Okay.
State level.
because the state's going to have to pick up this.
Okay, so I'm sorry, then I
He wants to know, what do we do, because,
okay.
I
Yes.
think to rephrase it, he's saying Republicans were the one who put this in place, and locally in our rural area, we are represented on the state level by mostly Republicans who have been elected. So what do we do about that? We tell them what we think. We call them, we write to them, we get things in the newspaper, you know, Republican, Democrat doesn't matter. We're talking about people and issues that affect people here. And they work for us. We elected them. If you really don't like it, vote for somebody different next time. Get your friends to run for office. Get young people in there. Get, just somebody different. I mean, your vote really counts. Your phone calls count. If Republican, Democrat doesn't matter. We're talking about
I think
people.
it does this time. It does.
Think it does?
Yes.
I think they will tally things.
Doesn't matter.
He's talking about,
So my question is, the SNAP coupons for generally seniors for this year, are they still available, or was the program already cut pretty seriously? So I know
The
that.
farmer's market coupons?
Yeah.
Yeah, those are active. We actually finally got them in our office 2 days ago. They're a little bit late, but they are, yes, that's fully funded, fully running program right now. Yep.
Good news. Thank
Yes.
you. Thank you.
You don't need a microphone. Still doesn't need it.
Hi, thank you. So what are these work requirements?
Well, do you want to talk about it?
What exactly are they?
So, I have a little, I wrote it down, it's pretty complicated, okay. So, Medicaid, as it exists now, has no work requirements. It wasn't envisioned that way, and it hasn't been that way. In place with this bill is a requirement for states to condition Medicaid eligibility for individuals ages 19 to 64 applying for coverage or enrolled through the ACA expansion group on working or participating in qualified activities for at least 80 hours per month, effective date being no later than December 31, 2026. Now, there are many exclusions, so that if you're at home caring for young ones, and actually the Senate version raised the age to 13, but if you have a 15-year-old that's disabled, you may not be excluded. So, I mean, it's not perfect, but there are many exclusions. If you're attending school, if you're ill or disabled, community service counts, and it's estimated that 92% of people receiving Medicaid now either are working full or part-time or would have an exclusion. So part of the cost savings really comes in the continued need to document all that and to administer all that from the state. That's my understanding. But that's a brief explanation of work requirements. There is evidence that shows work and reporting requirements are confusing and complex and costly for states to implement. And research also shows that access to affordable health insurance and care promotes individuals' ability to maintain and obtain employment. So, importantly, the CBO estimates work requirements show lower federal spending and an increased number of the uninsured, but no increase in employment. So that's work requirements. Do you have other questions about it? That's a very brief summary. It's pretty complex. So back in first Trump administration, a number of states applied for waivers in order to impose these sorts of requirements on Medicaid recipients. At the present time, only Georgia has such a requirement in place, and my understanding is that is how the federal government is modeling some of their plans for this. It didn't work in many states because what happened was many people lost insurance that actually should not have, just because of all the administrative hurdles.
I think we just have time for one more. Just one. Is it a good one?
Actually, it's not a question. It's a news for you all. Okay.
No, it's one of the speakers. I'm one of the organizers. She's in charge of this organization. Oh, sorry.
Thank you. First of all, I want to apologize because of my broken English, but given this news today, I just wanted you to know that I'm here as a representative of the Oneonta Community Health Center. We are a free clinic. We are located in Oneonta, and we provide primary care for uninsured and underinsured people. And I just want you to know we are here to help this community, and we are willing to serve whichever are in need of our services. Thank you so much.
That's actually a very positive note to end on.
We have another community organization.
Another community organization. Okay.
Hi, my name is Valerie. I work with Catholic Charities, and I assist people in applying for SNAP benefits. I help you with existing SNAP applications if you're having trouble, you don't understand if you qualify, how to go about recertifying or other questions. Totally free. I'll leave cards.
Thank you, Valerie.
This is like another side benefit. Other organizations and other connections are going to emerge to support us as neighbors and friends of each other. I would like first for you to give applause to yourselves for attending and becoming informed and participating in your democracy by being here tonight. And now I want even more applause for our presenters.